know it sounds funny, but I just can't stand the pain. Girl, I'm leaving you tomorrow. Seems to me, girl, I've done all I can. See, I've begged, stolen, I've borrowed. So I am easy. It's like Sunday morning. So I am easy. It's like Sunday morning. Good evening, folks. It's always a good start. Always a good start with a bit of ukulele. How are you all doing? And it's great to see you once again. It's great to be back. For those who are just joining us for the first time, welcome. Welcome to Kaz, just joined us there. This is a Care Managers Inner Circle set up, my goodness, 4 years ago. For one reason only, not to promote, not to advertise, not for ego. It was plain and simple to support us all care managers out there. It is a fast-changing world at the moment, and social care. You only have to see the legislation which has come out today on Freedom Day. I think they must have done that was some quite deliberation. But today there's a lot of changes. Last week, a lot of changes this week. And let me just remind you, for those who might not know, this time last year, we were certainly we're still going through it. Obviously the pandemic, it was a raw time, multiple deaths, undoubtedly the care homes and social care was the killing fields of these beautiful people. And it was quite devastating, actually, in the face of no PPE, no vaccinations, no testing. I remember those stomach churning days well, as we all do. And some care managers and care homes went through an absolutely, truly horrific time. And so at the moment, I just felt that in terms of Care Managers Inner Circle, we're here to support each other. For those of you who might say, you've been away, Jonathan, for a while. No, I just thought I'd just take a few weeks out of it and only contribute when I felt there was something worth saying. And recently, I just felt in the back end of last week and this week, there's something most definitely worth saying. And just to assist care managers, it's just pure and simple as that. So tonight, ladies and gentlemen, is not about me telling you how it is. I'm no guru on this. I've read the legislation just like you. We've got some fabulous people on the Care Managers Inner Circle, and they likewise are going over the guidance and finding some loopholes and lack of consistency. I think we've also got to bear in mind that the legislation has been issued at breakneck speed. There are going to be holes in it. There are going to be issues with it. And it's for us undoubtedly as care managers to pragmatically navigate our way through it and be able to deliver. We are best placed undoubtedly to deliver a pragmatic risk assessment for our care homes. So that is what tonight's about. But undoubtedly, social care has got an increased raised profile. I think 2022 is going to see that raised profile continue. I'd like to see that translating into increased resources. I think we'd all like that. I think, don't hold your breath. I'd like certainly Boris to deliver on his promise to fix social care. Once again, don't hold your breath on that. I think staff are going to come to the fore. They're our biggest challenge at the moment, and not challenge because of the staff, but our challenge in terms of keeping that amazing resource online. Increasing pressure is going to be placed on that critical resource in terms of their goodwill, plain and simple as that. Why go into social care if you're not going to be respected? And that goes everything from pay to conditions to just feeling part of an amazing organization. And I think that's where care managers and care homes, they've got to create their own tribe. It's simple as that. If you don't create your own tribe, your own loving tribe, a family which want to be there and want to stick together, then you're going to have some real difficulties, I'm afraid. And we've got to be more and more sympathetic to mental health. That's the biggest ticking time bomb. And for care managers as well. I think inspections are going to become more remote. They're going to become more targeted, and we're going to see certainly the change in CQC inspection regimes. They're already seeing less comprehensive, more targeted, more focused on risk, and tech is going to be at the forefront of that. That is the new frontier. Quite simply, care homes will fall into two camps. You're either technically enabled, or you're a laggard. If you're a laggard, you have probably the last fleeting moments to jump onto that train before it pulls out of the station for good, and you don't want to be trying to catch up, because it is moving already at breakneck speed. And the Care Managers Inner Circle is a big endorser, certainly of tech, because that's where it's going to be at, enabling quality care, etc. So tonight I'm going to keep it short and sharp as best we can. I just want to give you a bit of an update, guys, on the change in legislation. And I say I'm no expert on this. I'm just reading the same legislation as you. But you might be traveling tomorrow to work. You might be indeed sort of watching this on catch up, and it might be something that just as a bit of a summary for you. I'm just going to start with the press announcement this morning about double vaccinated staff will be able to be exempt from isolation. There are a few issues with this at the moment in terms of the guidance is not clear. And I think as Tanya, I don't know if she's on the live tonight, Tanya was able to identify very straight away, paragraph 9.2, where it clearly states that, if it's a community obtained or transferred COVID to a member of staff, then they may well still have to isolate. But I've asked for clarification on that. But in essence, the spirit of the guidance is about getting and enabling social care and NHS staff back into the workplace in order to provide care for those gorgeous people who need our help in their beds. It's going to require negative PCR. And they've got to isolate until we get that negative PCR. They've then got LFT for 10 days before work, and then just normal PPE in the workplace. They also state, and this is where the difference comes in, and where the challenge is, because it also clearly states should not work with clinically vulnerable. Well, you tell me a care home or a nursing home that doesn't have clinically vulnerable. They're all clinically vulnerable by the nature of what we do in delivering our care homes. So that's going to be a real challenge for us, and that's what we're seeking further guidance on. But ultimately, it comes down to the care managers, you and I out there, to make the pragmatic call. So the other thing as well, which bear in mind, it also says that staff outside of work have got to isolate. I don't know how they're going to police that. So you're able to go into work, but if you're not in work, like over a weekend or whatever it might be, then you've got to isolate. So I don't know how that's. Well, I just can't see that happening at all. Let's move on to visiting. So this was the guidance which was changed on the 16th of July. And so these are the main changes, or these are some of the main summary points. There's now no limit on the number of named visitors. And again, I'm not playing judge and jury on this, but this is going to be increasingly very difficult for care managers out there to police, and certainly it's a big challenge. There's going to be also no limit on the number of visitors per day. So basically, it's back to normal. Now, what I would say is that the guidance is quite clear, is that the ultimate call is made by the care manager in the care home, who's best placed to make the pragmatic risk assessment call on it. And so, of course, that is going to be our fallback. Essential caregivers may continue to visit even during outbreak, which is good news. Again, there's going to be some challenges with that, but certainly that is good news, as long as you put mitigating measures and good, well drawn out risk assessments in place. Hand holding is permitted when it comes to visiting, making sure that people have washed hands and the usual precautions beforehand. Hugging is permitted, which is great. I'm a hugger. So hugging is permitted for double vaccinated, both in terms of member of for your relatives and residents. Previously, there hasn't been a requirement to ask your relatives if they've vaccinated. There may well be now, if they want to, of course, hug. Other visiting permitted, such as windows, pods, etc., without any restriction. RAMs must be in place in terms of risk assessments. And once again, care home managers are best placed. And LFT ongoing for visitors as per normal. Right, in the event of outbreak, there's a few points here. Weekly, so the normal visiting is to stop, with the exception of essential caregivers and also end of life. Window visits may occur, which is quite different, because certainly previously they said window visits, particularly during when we're in lockdown, were not permitted because they couldn't guarantee that the windows would remain shut. But in this case, they're now saying that window visits may occur. And it's a 14-day restriction, so not 28-day lockdown, 14-day restriction, which is a move in the right direction, certainly. The only exception to that is if your local infection control team say that the variant that was identified in your home was either an alpha or delta variant, and it means then that they may well extend it to 28 days. So visits out of care homes, there is no isolation unless it is an overnight visit and stay in hospital, or indeed the risk, or indeed the visit that the resident has embarked upon was deemed too high risk. And that could be for someone of LD visiting whatever scenario or setting, and you just consider it just too high risk, then they would have to go into isolation on return. But all other visits outside the home should be supported with appropriate risk assessments. Are you all with me so far? I tell you, it's going to be a quick rattle through. Things that they say considering: vaccinations of the status of the people that your relative, or so your resident, is going to be visiting, any other testing of those who might be accompanying, such as a relative or loved one, taking them in a taxi, etc. Levels of infection in the community, activities that are likely to embark upon, whether it be a nightclub, or indeed visiting a packed restaurant, or indeed outside in a park. There's a big difference in risk assessment for that, and also the mode of transport. Are they going there by taxi, bus, train, or are they actually walking there to the park? And it just says pragmatically try and avoid crowded places, public transport. And of course, those who are accompanying your resident should also be LFT tested. So moving on, admission for people into a care home environment. Now, this is where there's two schools. There's in the same document there is two hours. It says that they've got to be tested 72 hours, and in another part of the document it also says 48 hours. Myself, I'd like to see 48 hours, giving you a closer proximity in terms of the testing, rather than sort of 72 hours where they could obtain. There's 3 days for them to obviously to get the transmissible virus. So may go outside. So this is 14-day isolation. So it's not 10-day isolation now. It is a 14-day isolation if your resident, your newly acquired resident, has come from an acute setting, a hospital, or indeed from the community. So that's 14 days, not 10 days. They may also go outside. And so over that period, in terms of, so when they're in isolation with you, instead of them staying in that room, those 4 walls for 14 days, they may now also go outside within the proximity, the boundary of your care home. You might have an open courtyard, you might have a back garden, front garden, but they may be transported out there. Again, you're going to have risk assessments in place for the movement through the home, but there might be homes that they can easily do that if you've got accessible doors outside. Care homes cannot be forced to take residents. Essential caregivers may visit during the 14-day isolation, but not if that resident is COVID positive, clearly. And that's to help them settle into the new environment and also to provide care. Community admissions, they must be PCR'd, obviously in the community, either 72 hours or 48 hours. Take your pick, whichever one you want to choose. They must be PCR'd on arrival. They must be PCR'd 7 days in, and they must also have a daily rapid flow test. Now, that was on, I didn't realize that, but that now is a daily rapid flow test. Support should be also given to supporting patients now, sort of outpatients and appointments, etc. But also bear in mind means of transport and people who might be attending with them. The test of residents twice daily with their temperature, looking for temperature anything over 37.8 degrees, or a cough of varying natures, but a cough of some of nature or any sort of respiratory change. Other additional things: shortness of breath, lack of responsiveness, new onset confusion, if they're off their food, if there is a reduced daily intake, diarrhea, vomiting. I mean, what that's just described is probably most of our residents every single day. And I say that with respect, because most of them are so complex, and so they're comorbidities that a lot of our residents have, those. So, to take your pick if whatever you can do. If a resident then deteriorates, 111 or phone the GP, and that's just a slight deterioration. We're not talking a drastic, serious deterioration, but if there is a life-threatening or very concerning deterioration, then clearly 999 straight away. If you've got an outbreak, undergo full testing of the home. That's both residents and also staff with PCR. And this is where then, so the outbreak plan is that you would PCR both residents and staff, and then you would also test all residents and staff between day 4 and day 7 and LFT them on every single day. If after 7 days there's no further positive cases in your home, then you can then revert back to the normal testing regime as per the guidance. So that's reassuring. Contact your local infection control team, see what variant it was, whether it be Alpha or Delta, and they will decide whether or not you've got to extend your lockdown period. So just to reiterate, the lockdown period used to be 28 days. It is now 14 days unless your local infection control team say that they're going to expand it to 28 days. End of life is no change. Visiting may occur, again, with normal measures and risk assessments in place. PPE, the free PPE is going to continue till April, or to the start of April 2022, and continue to use PPE as directed. So that's no change on that. Right, I just want to talk about vaccinations. So, of course, we've all been informed. It's still going through I think it's gone through the House of Commons and been endorsed by ministers. It's just waiting for ratification in the House of Lords. But it's looking as if that legislation will go through, which will deem that anyone working in social care will require to have 2 vaccinations for them to continue to work. I've got my own views on that. I've been quite vocal, actually, in terms of I think it's the wrong approach. But nevertheless, it looks like it is going to become law in due course. It's for us certainly to prepare our staff. There are various letters at the moment going into circulation. But undoubtedly, I think this is going to be law, and it's going to be for us to brief that new change in legislation and law with all the HR complications and challenges that will bring over the next few months. That's all I can say. CQC, just finally, you'll have heard I issued on the Care Managers Inner Circle tonight the new data, the COVID death data. Sounds quite macabre. But that will be issued on Wednesday this week. It's going to be the release of all the COVID death rates by care home. And therefore, there are things that I think we're all duty bound to make sure that we prepare our staff, prepare our residents, our relatives. Don't have them reading it in the local newspaper. I think we owe them that, and the respect for them for that. And just make sure that if required, press releases. I think it's quite unfair myself. Because a number of those deaths were acquired in an acute setting, in the hospital setting, and yet and of course, by the time we realised that these residents had COVID because they weren't tested, as Matt Hancock said at the time, they weren't tested. They were put into the community, into care homes. We later found out that they had the virus and they died in our care homes, and yet the care homes will be the ones that will take the fall for that, not I'm afraid, Mr. Hancock or any of the establishment for allowing that to happen. So I do have my views on that, and I think it's going to be very unfair because, of course, the media will take its own view on providers and social care as a whole. Team, lovely to see you. Lots covered tonight. Once again, I'm not saying I have all the answers at all. That was just my interpretation. I might have got some of that wrong, and apologies if that is the case. Hopefully you found that useful. Some great news I'll be announcing shortly. We're going into partnership once again with the Care Show. The Care Show this year is on the 13th and 14th of October. Really looking forward to that. We've got the Care Managers in a Circle, which is going to be down in Birmingham, part of the Care Show. We've got a fantastic lineup of speakers. And once again, thank you to Michael Corbett for inviting us along and being part of his event. It's great news. Right, folks, I'm going to love you and leave you. Well done. Keep doing what you're doing. And remember, sharing is caring. See you soon. Bye for now.